Today we are going to discussing about common fungal infections. Now, in our climate in India, where the climate is very humid and it's so hot, this is something that every one of us should know. That is fungal infections. Fungal infections, as you all know, grow more in humid climate. And as a local language we say in Hindi, Dad, Haja, these are all fungal infections. Now, fungal infections can affect various parts of the body. It can affect your groins because of mostly most people who wear shoes, they can affect your feet, your body surface, your axilla. And nowadays, because you wear a lot of masks in the face, in the scalp also, you can have the fungal infections. People who use a lot of water in their daily activities can have fungal infection in their hands, in the nails, and so on and so forth. Nowadays we see a lot of fungal infections, and the major cause of these fungal infections is humidity or people who sweat a lot. They don't go and clean the sweat. They go on doing their daily duties wearing that wet cloth, and that increases the fungus. And because we know the damp conditions increase the growth of fungus. Now, what are the symptoms? Mostly, if it is dermatophytic infections, it is itching. We can see a lesion or skin disease, very itchy all throughout the day. Mainly, it's just when they sweat, and that is the major complaint. And how to prevent such? What we should always remember that whenever you have any sweat in your body, wipe it off. Sit under a fan, dry it off, and make sure to change your clothes regularly. And every cloth you wear, every piece of cloth that you put on your body should be properly washed and ironed. That is very important. Iron the clothes, even your innerwears people wearing in the summer. And obviously, you have to maintain a good hygiene. And in your workplace, make sure that there is proper aeration, which is not always possible, but at least try to have a proper aeration so that you do not sweat a lot. Now, if there is something that foot fungus, people who have to wear shoes and socks all throughout the day, make sure for the socks you can use an antifungal powder and clean your socks regularly, wash them up. You may or may not iron the socks also properly before wearing them. Do not go on using the same socks for days together because that will increase your fungal infection. And how to prevent other fungal infections, as I already told, mainly if you want to prevent against the nail fungus and all, make sure that every time you put your hands in the water, take it out and then clean it with a cotton cloth. Don't keep that part of the body wet because that will make sure the fungus grows rapidly. Now, what are the home remedies? There is no actual home remedies for fungus. Please, most of the fungal infection that we see in our practice is becoming very resistant to treatment. The major cause for this resistance is the over-the-counter medications that you apply in your fungal infections. And not only that, the ointments that are advertised in the TV, these are very notorious in causing the fungus to become resistant because these contain steroid in them. And when you apply steroid in a fungal infection, that makes sure that the fungus becomes resistant to the treatment. And that's because of that, it takes months together for us to cure a person totally of the fungal infection. Now, there is no home remedy as such for fungus. Only the home remedy that you can have is to keep yourself clean, maintain a proper hygiene, make sure after you take a bath, clean yourself, dry yourself, then wear your clothes. Don't wear your clothes over a wet body, and make sure you keep your towel, your soaps separately from other members of the family because if one member has the fungal infections, he or she will spread it to other people where it's infectious. Now, when to see a doctor? In a fungus, anytime you have a fungus lesion, if you see that you are having fungus, please don't go to a pharmacist and to try your over-the-counter medication. immediately go to a doctor and apply the ointment. Remember, the ointment the doctor will prescribe, the antifungal ointment, should be applied not only in the disease but surrounding areas also, and should be applied at least 2 to 3 weeks beyond the lesion period. And the oral medication should also be taken in case there not one but many lesions in the body, and I am sure your local dermatologist will prescribe that. And I hope this overview of the common fungal infections and tips to prevent will help you. And if you are interested in seeing such other videos, please visit DermaVidya.com. And as a doctor, my sincere advice to all of you is that for any skin, hair, and nail infections, please do visit to your local qualified dermatologist and seek his or her advice. Rather than going to a medical store and applying some cream, we should increase the disease in the long run and not only increase your cost above the burden of the treatment that you have to take, but also make the fungus resistant for the doctors to treat. Thank you.
For more such videos, visit or log into dermavidya.com.